Welcome to Channel 6 Nightly News. I'm Veronica Corningstone. There's been an E. coli outbreak in the Tri-County area, officials say. The source has not yet been determined, but E. coli usually spreads through contaminated water and meat, sometimes hamburgers. Symptoms are similar to the stomach flu, such as stomach and abdominal pains, nausea, vomiting, diarrhea, and other gastrointestinal symptoms. However, symptoms can be worse and sometimes fatal. Here to talk to us is Dr. Andrea Richardson, a biostatistician and epidemiologist from the Centers of Disease Control and Prevention. Dr. Richardson, help us make sense of the numbers.
Thanks, Victoria. As a biostatistician and epidemiologist for the CDC, we assess the health of the people, gather the data, make sense of all the findings for the public's knowledge and well-being. According to our data at the CDC, foodborne illnesses sometimes fly under the radar, but can be quite serious. About 250 diseases can be transmitted through food and can cause about 9,000 deaths a year. E. coli infections are one of the most common of those foodborne illnesses. E. coli, a bacteria pathogen that can be spread from contaminated water, agricultural crops, meat, as well as products like peanut butter and your spinach. It is very important for us at the CDC to know when an E. coli outbreak occurs and the rates of diseases that are higher than the normal endemic rates. This alerts us to a problem and can allow us to prevent more infections by recalling the contaminated product or properly inform the public about the health issue. Our biomedical scientists at the CDC believe that this outbreak may be due to some ground beef and that has been distributed to numerous grocery stores and fast food restaurants. E. coli infections are not due to your hereditary. As some of you may know, genetics is only 25% of your health status. However, 15% is your environment, and 10% is our access to medical care, and 50% is purely behavior. This means that if your environment, such as the food and water in our area, is contaminated and your behavior dictates where you choose to get your food and what you eat, you have an increased risk. Then, if you have poor access to the medical care, the infection may not be identified and reported properly, which then makes others at risk for a lack of proper awareness of the contamination. A big part of public health is knowing the people, the culture, and being able to effectively communicate health issues and prevention to them.
Thank you, Dr. Richardson. I'm sure we can all benefit from that information. Next, we have Betsy Lynn, a citizen of the general area. She speaks about her concerns upon hearing about the outbreak of the E. coli contamination.
Well, I heard about the outbreak, and it certainly makes me nervous because I have kids, I have a family, and we have to eat and drink, you know? If we didn't know what food is contaminated, how are we supposed to know what to eat? Plus, if one of my kids starts to get sick, how do I know it's not just a stomach bug they caught at school? I'm low income. I don't have the time or money to take them or myself to the doctor, just in case. Even if I'm poor and I can only buy fast food for my family, I should have the comfort in knowing that the food and water is safe. I want them to be healthy. I want to be comfortable knowing we're safe here. I want public health scientists to work with the government to make laws that make sure food is safe. My environment is safe. Not knowing stresses me out. I get anxious, and then my emotional health suffers as well. It's all connected.
Thank you for your time and thoughts, Betsy Lynn. You make some valid points. And as Betsy Lynn pointed out, it is very important to know the source and determinants of the infection. Our next interview in our E. coli segment is with Dr. Nathaniel Schlotzky, an environmental health scientist. Thanks for joining us, Nathaniel. What can you tell us about the E. coli outbreak, not just from a public health perspective, but also environmental, since this is obviously very connected?
You're right. Health science is definitely connected to the environment, especially in this case. E. coli contaminations are due to improper food and water conditions. These types of infections can easily be prevented if the right course is taken. It is my job to research the land, soil, and water to make sure that everything is safe for the public. Once we can figure out things that harm the public's health, we can work towards policy development with the government and the EPA for higher environmental standards. Additionally, we work with private organizations and businesses that promote environmental awareness and health. When we know what the risks and determinants of diseases are, we can implement interventions and monitor for effectiveness. For example, we can collaborate with private environmental engineers who can make specific designs for the best possible environment in a situation. This way, the circumstances that increase risk are decreased and prevention is stronger. Environmental health is still a developing field of public health, which means there is a lot of room for progress and research.
For all of you who have been tuning in with us this evening, thanks for watching. All of the information has been to your advantage in this time of a rising health issue. Here at Channel News 6, we will keep you updated to let you know any new findings on the E. coli contamination. To end our segment, here is a touching message from Kathy Carroll, a food advocate and mother.
It is a great service for this channel news to dedicate so much time to this epidemic. 5 years ago, my son was 3 years old. He never made it to his 4th birthday. He died from an infection from E. coli contaminated meat from a fast food restaurant. I had never really heard much about E. coli contaminations, how they spread, the symptoms, or anything else. Knowledge is vital to prevention. If you promote education, if you regulate systems, if you work with other fields to develop better courses of actions, watch those courses and make sure their working prevention can be attained. I'm now a voluntary food advocate who petitions with the USDA and with other members of the organization in order to have higher standards and regulations and better awareness on the topic. Next month, we're holding a fundraiser to gain support and funds for researching E. coli and other foodborne illness. Please come and support us, because every penny helps and every person who is aware can help too.